Diagnosis 101 Your Guide to Wellness. Welcome to our channel. Today, we'll dive deep into the topic of benign prostate enlargement, also known as BPH. Before we begin, let's understand what BPH is. BPH is a common condition where the prostate gland grows larger as men age. This enlargement can cause bothersome urinary symptoms, affecting the quality of life for many individuals. If you find this information helpful and want to stay updated on health-related topics, don't forget to hit that subscribe button and click the notification bell. Also, feel free to share your thoughts or questions in the comments below. Prevalence. BPH is highly prevalent, especially in older men. It becomes increasingly common with age, affecting around 50% of men over the age of 50, and up to 90% of men over the age of 80. Causes. The exact cause of BPH is not fully understood, but it is believed to be linked to age-related hormonal changes, specifically the conversion of testosterone to dihydrotestosterone, DHT. DHT is responsible for prostate cell growth. Symptoms. The symptoms of BPH are related to urinary issues and can vary in severity. Common symptoms include frequent urination, especially during the night, nocturia, difficulty starting urination, weak urine stream, intermittent or stopping and starting urine flow, feeling of incomplete bladder emptying, urgency to urinate. Complications. If left untreated, BPH can lead to various complications, such as urinary tract infections, UTIs, bladder stones, acute urinary retention, sudden inability to urinate, and kidney problems. Diagnosis. Diagnosis of BPH typically involves a thorough medical history, a physical examination, including a digital rectal exam to assess the size and condition of the prostate, and various tests like prostate-specific antigen, PSA, blood test to rule out prostate cancer, urinalysis to check for signs of infection, urinary flow rate measurement, ultrasound or MRI to visualize the prostate and rule out other conditions. Treatment. The treatment approach for BPH depends on the severity of symptoms and their impact on a patient's quality of life. Common treatment options include watchful waiting. For mild symptoms, periodic monitoring may be recommended. Lifestyle changes. Reducing caffeine and alcohol intake, avoiding excessive fluids before bedtime, and regular exercise may help. Medications. Alpha blockers and 5-alpha reductase inhibitors are commonly prescribed to relax the prostate and reduce its size. Minimally invasive procedures. In more severe cases, procedures like transurethral resection of the prostate, TURP, or laser ablation may be recommended. Surgery. Surgical removal of the prostate may be necessary for very large prostates or when other treatments are ineffective. Here are some interesting facts about BPH. Prostate size. The prostate is typically about the size of a walnut in younger men. However, as BPH progresses, the size of the prostate can increase significantly. In some cases, the enlarged prostate can grow to the size of an orange or even larger. Hormonal influence. BPH is thought to be influenced by hormonal changes, particularly the conversion of testosterone to dihydrotestosterone, DHT. Interestingly, DHT is the same hormone responsible for the growth of facial hair and male pattern baldness. Ancient Egyptians knew about it. The condition of BPH has been documented throughout history. Ancient Egyptian medical texts dating back thousands of years mention similar urinary symptoms that are associated with BPH. No prostate, no BPH. BPH only affects individuals with a prostate gland, which is a male-specific organ. As a result, women are not at risk of developing BPH, even if they have hormone imbalances. Linked to height. Some studies have suggested a correlation between height and the risk of BPH. Taller men may have a slightly higher risk of developing an enlarged prostate compared to shorter men. BPH and dementia. Some research studies have explored potential connections between BPH and dementia, speculating that BPH might be associated with a slightly higher risk of cognitive decline. However, more research is needed to establish a definitive link. BPH and marriage. Surprisingly, there have been studies investigating the connection between marital status and BPH risk. Some research has shown that married men may have a higher risk of BPH compared to single men, but the reasons behind this association remain unclear. Zoo animals and BPH. Interestingly, BPH is not limited to humans. Older male zoo animals, such as chimpanzees and gorillas, have also been reported to experience prostate enlargement. Medications and BPH. Certain medications that were initially developed for other purposes have been found to have a side effect of improving BPH symptoms. For example, the medication finasteride, which is primarily used for hair loss treatment, is also used to manage BPH. Disclaimer: the information provided in this video is for educational purposes only and should not be considered as medical advice. Always consult with a qualified healthcare professional for personalized guidance on your health concerns. Thank you for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Until next time, stay healthy and take care. Diagnosis 101. Stay curious, stay informed, and stay healthy.